Welcome back, guys. Today we're going to be talking a little bit about the ward round, particularly about what to do after the ward round, and also what's involved in a paper round. Again, I like to say that please, if you have any troubles, consult your senior and always use some common sense. So now that you've completed your ward round, you've got your list of jobs that need to get done. So I like to divide them into three parts: investigations, consults, and discharge paperwork. So in terms of investigations, obviously you can divide them into bloods, radiology, and other including procedures. What's always important is to think about how to prioritize things. So in terms of the bloods, so order only essential bloods. There's no point in ordering bloods if you're not going to check it. And two, make sure that once you've organized bloods, you can check them on a regular basis. In terms of radiology, again, always prioritize. If you need to get an urgent scan, book it in early because, for example, there's only a certain number of CT scan slots, and if you don't get in early, it'll get pushed till tomorrow or the day after. So some of the ways I'd like to make sure that I get the scans is to, for one, go early, two, go in person so they can't really reject you, and two, speak to the registrar who puts the bookings in, and get to know the radiology staff so you're on good terms. Other things include procedures. Very occasionally you might need to organise a procedure. Again, it's always important to speak to the appropriate person and to book those in early. Now, in terms of consultations, I'd like to think about them in three parts. So, allied health consults, medical, including obviously other, including psychology, psychiatry, and surgical. And check back to one of it. I'll be doing another video about the consults later. But again, with consults, try to get them early and to prioritize them as well. Lastly, after you get all of these things done, it's probably the most bulk of your work will be doing discharge paperwork. And again, I like to separate those into three parts. So there's the discharge summary itself, which I think is important to get started. The worst thing is, you're doing rehabilitation and you get dumped with a patient who's been in hospital for 6 months and there's nothing that's been started, and you have to start from scratch. So what's always important is to start early, add little bits and pieces in, tidy up things to make it really a summary, and avoid putting extraneous amounts of investigations or results into the discharge summary. But we'll be doing another discharge summary talk a little bit later. Two medication scripts. Again, it's probably important to send off medication scripts the night before or a couple of days before if you need Webster packs made. And three, appointments. Although for a lot of patients you can trust them to make their own appointments, but in certain instances it's probably better that you make the appointment, and so that you can put it in the discharge summary so the GP knows when the appointment is and the patient knows, and it's less likely that the patient will be lost to follow up. Last thing we're going to talk about is paper rounds. So paper rounds, I think, are quite effective ways of communicating or having a bit of a verbal handover throughout the rest of the day. You can go through it fairly quickly in terms of what you're doing is just saying quick updates. So for example, Mrs. Jones, she's had her chest x-ray, looked relatively normal, or the family meeting's at 1 o'clock, do you mind if I go, etc, etc. And it's probably useful to get at the end of the day to also have a bit of a paper and tie up any loose ends and to plan for what's happening tomorrow. So for example, if for some reason the pleural tap didn't happen today, then it's important we write that down as a priority to get done tomorrow. So I hope that was helpful, guys. I'll see you guys next time.